Hi everybody, it's David Osborn here from UCL, one of the co-leads for the Public Mental Health Programme. I'm going to give you a very quick recap of the elements of the programme before two presentations giving you a bit more depth. So just as a reminder, you can see the other two leads, Kate and Judy, on the left there, and obviously our main overarching aim was to deliver some high quality evidence to improve mental health, but across the life course. So if you remember, in the first phase of our programme, we aimed to deliver 4 work packages, and they've all delivered with our conceptual framework, identifying a core public mental health outcome set, looking at the mental health of young people in educational settings, and also looking at interventions for people experiencing psychosocial stresses and life transitions. So we're very pleased that the conceptual framework for public mental health is out there, is having influence, and you're going to hear more about that later on in the presentation, but the website is up there on the slide. And of course, the core outcome set led by colleagues in Sheffield has looked at public mental health outcomes in a range of domains, which you can see in the centre of this slide. And then we had work looking at a variety of aspects of young people's mental health, including LGBT youngsters, and also work around COVID. And once again, you're going to hear more about that later today. And the final part of our phase 1 was a variety of reviews looking at what evidence exists out there for interventions to improve public mental health. So we're delighted that there are a range of manuscripts published now in working age adults, also in ethnic minority populations, as well as older adults, and also mapping of local policy and practice across England to identify public mental health interventions. And of course, they all fed into designing phase 2 of our programme. So moving on to phase 2, which started October 2020. So I have to mention, of course, all of this work's continued through the pandemic, and we've been focusing on promising interventions, again, for adults, older people, as well as young people. So as a reminder, the phase 2 projects were divided into those for adults and older people, and then there was also work focusing on schools and young people. Within the adult population, we had 2 projects looking at co-located services for people who were working age or who were older adults. So delighted that colleagues from across the school led different work packages here. And then we had a project that worked with our efficient and equitable public health systems theme, looking at public mental health interventions, what we called a big data package, using big national primary care data to look at time trends in people with people developing common mental disorders. And then very pleased to have a public patient involvement element with a project led by our colleagues from PIN, and you're going to hear about that later too. So regarding the children and young people, we had 2 projects really looking at school culture and its impact on student mental health, as well as looking at young people's motivations for using substances in the context of mental health. And then finally, of course, the creation of a network to characterise and improve adolescent mental health and wellbeing, the South West School Health Research Network. We really felt that we learned so much through the programme about public involvement and what that meant in public mental health, working with colleagues at the McPin Foundation. This slide just summarises some of the various initiatives that we had and some of the outputs. You're going to hear from Gillian Samuel later on with a bit more detail about some of the ways that we approach PPI and what we've learned. And finally, just to mention our huge public mental health network that's been set up through the programme. We've got nearly 300 members. I can't believe we've had 17 newsletters and news bursts over the 2 years. We recently held our second virtual symposium with really impressive range of registrants coming along and a very diverse set of talks. So the network hopefully continues. To sign up, there's a link down there at the bottom of the slide. So just to finish with a thank you to everyone who's been involved, who supported the programme, and hopefully I've kept to time.